Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to discuss what causes the potential for having pain in the back of your knee after knee replacement surgery, and what are some things that you can do to help manage and relieve this pain and discomfort. So when you have arthritis in your knee joint or any joint in your body, it's going to affect the volume or the space that your knee takes up. And the reason for this is a normal healthy knee has the top component, your femur or your thigh bone, and it has the lower part, your shin bone or your tibia. And there's that normal healthy space between the two bones. There's the fluid, the joint fluid, and there's the cartilage there. Now with arthritis, there's breakdown of that cartilage, there's decrease of that lubrication and of that fluid, and that causes the narrowing of the space between the two parts of your knee. And that's where you hear the term joint space narrowing, or you hear bone on bone, because that space has diminished and decreased. And you can see if that space diminishes, then the volume that the knee takes up also is going to diminish. And what that means is all those tendons and ligaments and all those tissues that are on the outside part of your knee joint, they're going to shrink down just like how the volume of the knee shrinks down. And another thing is, as a compensatory technique or strategy, these tissues, the ligaments, the tendons, they're actually going to tighten up. They're going to become very taut as a way of helping to stabilize your knee. Now, when you have a knee replacement surgery, the surgeon is going to go in there and they actually take a good look at the alignment of your knee, the length and the tension of the ligaments on the sides of your knee, and they do their best to optimize the fit and positioning of the knee joint. So what that means is now they take these very tight tendons, and now as you restore that space and that fluid and the mechanics and positioning of the knee, now there's an increase in volume and an increase in space of that knee joint. So now those ligaments and those tendons that are already tight now are getting pulled and stretched even more. So that can happen with your hamstring tendons, so those tendons in the back of your knee. It can happen with the ligaments in the side of your knee and the tendons on the attaching to the side of your knee, and any soft tissue that surrounds and stabilizes the knee joint. So that's one big factor for the potential for having this pain and discomfort. Another thing to think about is that there's going to be inflammation. So your knee is swelling, there's inflammation, a normal part of the healing and recovery process. But what that can cause is it can trigger some of those pain receptors and cause that sensation of pain and discomfort. And then there's just going to be some general sensitivity or hypersensitivity of the nerves of your nervous system. So the peripheral nerves that are coming from the knee joint, and also your central nervous system, your spine, your spinal cord, and your brain. So the information is being transmitted, and essentially your body has become extra good or too good at transmitting those pain signals. Your body is very sensitive to anything going on at the knee joint right now. And then the last thing is you're just going to be moving differently, and that means different stresses on different bones, different stresses on ligaments and tendons, and different parts of your knee joint. So those are all things to keep in mind and think about. Now, what can we do about this? Well, the best thing to do is you have to allow the body, you have to allow the tendons and the soft tissue and the ligaments, you have to allow the nerves. Everything is going to have to adapt and basically retrain itself into the new fit, the new positioning, the new movements of your knee and of your body. So how do we do that? Well, one is time. Time as your body heals, as the inflammation decreases, and just giving it time for everything to adapt and realign, the tension of tendons and ligaments to adjust. That's going to be the most optimal way to alleviate this pain. Now we can help expedite this with movement, with both the exercises and movements you do through therapy already, so range of motion exercises, strengthening exercises. You can do strengthening exercises that are focused on your hamstrings or the muscles and the tendons in the back of the knee, or you can do just general global exercises, body weight squats, step ups, things of that nature, to strengthen and stabilize those areas. And as you do these exercises and movements, and then you start to also incorporate the normal movements that you do in your day-to-day. So activities that you enjoy, if that's walking, gardening, cycling, whatever that may be. Of course, being realistic and following the education and instruction from your therapist, from the surgeon. So movements, exercises, physical activity is going to lead to this adaptation of the soft tissue, adaptation of your hamstrings and the tendons and the muscles. It's going to lead to retraining your nervous system, so retraining those nerves that are hypersensitive and having them calm down and not be as sensitive and overactive. And of course, as you heal and recover, that inflammation is going to go down too. So that's the best thing, is give it time and just keep moving and keep your body moving. And among that, you can work with your therapist to set certain parameters, progress and go up in a progressive nature and how much activity you do. But really, it's that simple. Just give it time and keep your body moving and keep active as best you can. Stay consistent. I hope this video was helpful. Be sure to leave a like so you can spread this video to others who may find benefit from it. Be sure to leave your comments, and of course, be sure to subscribe if you don't already, so you can catch all our videos related to knee replacement surgery, frequently asked questions, exercises, everything else in between. Thank you very much for watching.